Thanks for that report, Rita Kanya. To just help us unpack all the stats and all the numbers and where we stand right now, we do have a gentleman, a doc from the Uganda AIDS Commission, Dr. Nelson Musoba, who actually is the Director General. Dr. Musoba, thanks for making time to speak to us.
Thank you for having me.
Let's start on the figures. 1.4 million living with HIV right now in the country, close to 54,000 on an annual basis who are contracting the disease. I don't know if I'm right on the numbers. Give me a sense of vis-a-vis COVID-19 and these daunting stats, how bad are we doing now?
Well, we globally, when you compare to the global statistics, we are among the front runners, but our burden is still huge. And of course, the COVID-19 implementation of the guidelines kind of impacted negatively because when the lockdown was implemented, it meant that first of all, public transport was closed. People could not easily, they had to ask for permission to be able to travel to refill their medications, to access HIV testing and other services. That could lead to a disruption. There are those who could not access their food. You need, to have your meal to be able to swallow the ARVs.
Right.
And if you disrupt the treatment, then your viral load will go up and the chances of transmitting to your sexual partner is higher. So we are hoping that that against maybe the lockdown and reducing on the movements and interactions, we will see at the end of the year how that turns out in terms of new HIV infections.
But Doc, my question then would be, if it is the Ministry of Health that did issue the SOPs, and it is very cognizant of these same facts, that we have close to 1.4 million people sitting in the country with HIV and AIDS, then why wouldn't it have a small provision in the SOPs for people with HIV and AIDS who are living with it right now?
There are provisions for them. In fact, there were special guidelines issued to guide access to HIV services. There were instructions issued to RDCs to prioritize people living with HIV. But there is the issue of stigma. It meant going to the chairman, to the RDC, and telling them the reason why you want to transport. And probably where you live, you've never exposed your status. So already stigma and discrimination is a barrier, to accessing services.
Right. Let's talk about some of the goals, end AIDS by 2030. Just the other day, I was going through the our goals to be a middle-income country by, yeah, let me not go there. But is this overly ambitious? 2020, is this achievable?
It is ambitious but achievable because the science has shown that we are reducing the infections, but it requires a lot of work from us. It cannot be achieved purely by the Ministry of Health. It can't be achieved purely by government. It will be all of us. It will be you and me taking responsibility, knowing your HIV status, looking out, for your partner, for your family member, for your community member. If we look out for each other, that is achievable.
Well, what are we doing right that the likes of South Africa are not doing right?
We came out first thing. What we are doing right for HIV is the same that we are doing for COVID. While lots of countries could not mention that they had HIV because they thought it would impact on their tourism and other things, Uganda was one of the first, to come out and say, we have this problem. So opening up early, breaking the barriers of stigma and speaking openly, giving people information is one of the strategies that enabled us to lead, among the others.
Doc, let's talk about a very fascinating statement that was issued by the Minister for the Presidency, who came out and said that there's actually a vaccine. Now, this reminds me of some politicians earlier on in the year who came out very, very happily and said that the Uganda as a country has gotten in touch with some very smart people and there is actually a COVID-19 vaccine. Away from the politics, give me a sense of your role and how you're enforcing it as a medical practitioner to make sure such news does not go around which is not substantiated.
Well,
is there a vaccine, is what I should have started with.
There is no vaccine. There is no vaccine for HIV. And the number one measure is still protect yourself. There is treatment, but it's not a cure. So there is no vaccine. There is no cure. The treatment is for life.
But Doc, the Minister for the Presidency is saying otherwise.
I think, from the political side, there is always wishing for the best, the ultimate goal. If you've seen how the president has been listing the major fronts for fighting COVID, he said if the vaccine comes, that would be the best way to deal with it. And I think the minister was thinking about the vaccine for HIV as being the ultimate, but currently we do not have a vaccine.
Thank you very much for that, Dr. Nelson Musoba, who is the Director General for the Uganda AIDS Commission, just giving us a sense of where we stand as a country on the fight against HIV and AIDS. And maybe to put that out very clear, there is no vaccine, something that has been reiterated by other politicians in the country.